I did just want to start and say thank you for this award. I'm really honored to receive it. And what I thought I would do in the short time today is just to share a little bit with you about myself and who I am and my background, a little bit about the work I'm doing now and excited about, and a little bit about who I work with as well. So the title I have is Better Prediction and Decision Support to Improve Healthcare and Outcomes for Kidney and Cardiovascular Disease, because this is what I hope to do in my research. And I just wanted to tell you a little bit about me. That's me in the boots there with my younger brother above the pulp and paper mill in Powell River, BC, which is where I grew up. It's a little hazy, so it's been faded photograph, so it's a bit hard to see, but this is where I grew up, and that is actually Powell River there, which you can just see a little bit of the water there. It's the second shortest river in the world because it's actually dammed by the pulp and paper mill there. That's where I grew up, and then I went on to do my medical training in Vancouver at UBC, and through the things that happen when you're in medical training and pursuing further training, I ended up in Calgary for internal medicine and nephrology training, which actually turned out to be one of the greatest fortuitous things that happened during my training program. And so after completing clinical nephrology training, I did a PhD under the supervision of Brenda Hemmelgar and in the Department of Community Sciences here. Spent a year at Stanford doing some additional research, and then came back to join the Division of Nephrology in the Department of Medicine, and went on to get a cross appointment in Community Health Sciences, where I am now. And I've put down some roots in Calgary, and this is my current family. This is my wife Carmen and our two daughters, Amelia 6 and Mirabelle 4. I am a kidney doctor, so a lot of my work focuses around trying to improve the care and outcomes for people with kidney disease. This is somebody, a person with kidney disease receiving dialysis, and many people don't realize that the health experiences and outcomes of people with advanced kidney disease are as poor as many people with many cancers, and it has a large impact on costs and resources in our healthcare system as well. So what I hope to do in my research is, as Bill said, use resources around us to improve health and healthcare. And a large part of how I'm interested in doing that is taking a precision health approach and developing tools, including models, that we can deliver into care in real time to support decisions. And this is a slide from a collaborator, John Spurtis, in the United States, that I think shows us really well this idea of taking information and synthesizing it in ways that we're not inherently talented in doing as humans, and then incorporating that into what we do every day, so that we can actually recognize people who have very different risks and potential health outcomes, and make decisions in their care that's around this. And I really do apply this, I think, at the intersection of kidney disease and cardiovascular health, where we're often challenged to make decisions that are going to lead to the best outcomes for our patients, because there's inherently trade-offs in many of the things that we do, whereas some things to improve health outcomes might have consequences and risks to kidneys, and we're really seeking to try to maximize benefits for our patients in both those ways. The first area I wanted to talk about is work we're doing in cardiovascular care, and this is where it's been a really interesting experience to work with stakeholders in cardiovascular care to try to implement predictive models and pathways that can make cardiac procedures safer for people with kidney disease. And to do this, it's really involved a number of people working with the Alberta Provincial Project for Outcome Assessment in Coronary Heart Disease to implement risk prediction tools into clinical care and deploy them in real time in cardiac catheterization procedures, so that now much of the data that's entered into a software like the Approach platform, which collects a lot of procedural and outcomes data, can actually execute risk models in real time and feed back to cardiologists who provide these procedures with information about how they can do procedures more safely. So this has been a very rewarding thing to do. We get to interact a lot with frontline staff across the 3 cardiac catheterization units in Alberta. And these are one of the meetings up in Edmonton with the staff developing an implementation strategy for the cath lab up there. And this is actually staff from our cath lab here in Calgary after deploying the system. We've also tried to incorporate this into our newest electronic medical records. Some people work in the hospital will be aware of Sunrise Clinical Manager, and implementing these tools into surgical care has been another area we're focusing on. And this is one of our coordinators and an educator in vascular surgery who's implemented these models into our surgical care areas. I'll skip over these, just to focus on the last area that I wanted to talk about, which is where we're going next, which is really moving from primarily taking a focus on working on delivering this information to care providers, but moving it on to actually engage patients and deliver this directly to patients and their interactions with care providers in a shared decision-making framework. And a lot of this is being done through a SPORE network, the CanSolve Chronic Kidney Disease Network, that focuses on strategies for patients with kidney disease. These are patients and a number of members from this institute involved in working with patients to identify ways to improve their care and to feed this information back. And now we're working on actually taking these types of models and data and incorporating them into tools that can be shared with patients and providers to guide decisions around procedures where there's some trade-off around heart health versus kidney function. I'm just going to end by thanking many people and groups that help do this work, the patients who are involved in this, the frontline care providers who are so committed to implementing these things as well, and the research team members and collaborators who support all of this. And also just a real acknowledgement that I think the O'Brien Institute provides a fantastic interdisciplinary research environment to make connections with people who have expertise in different areas to support this work. So I'll stop there and say thank you again.